Hi, I'm Haresh Mehta. I'm the consultant interventional cardiologist at PD Hinduja Hospital, Khar. Tavr is transcatheter aortic valve implantation. Now, why are we talking about this? Since time immemorial, the treatment of aortic valve disease has been surgery. So, why are we talking about non-surgical aortic valve implantation? The reason for this is that there were a body of patients which were left medically because the surgeon said they are very high risk for surgery, and then they were led to suffer despite having a good lifespan remaining. They were told that nothing can be done for them. This led to this therapy, which was first used in man in 2002, and it was found to be successful, where the valve was replaced from the groin using the femoral artery, and the valve was implanted in such a patient, and the patient did well after the procedure. And this revolutionized the aortic valve space. That's how it started. It started for high-risk patients, patients who could not be operated. And then we started realizing, why don't we try it for patients who are not very high risk or intermediate risk for surgery, where options both are available, or even for low risk. And these trials have now suggested that this kind of therapy, which is called TAVI, can be easily done in such patients with equal or non-inferior results to surgery. So this has opened up the space for a non-invasive management of valve disease. TAVI basically is replacing the aortic valve, a valve in the heart, without surgery. Since the advent of medicine, the treatment of aortic valve disease has been surgical. That means the surgeon replaces the valve. But there are multitude of patients who are old, infirm, where the surgeon says that they are high risk for surgery and you cannot do anything for them, and they were left alone. And that was a very sad thing, because these people would normally have a good lifespan, but they were told you can't get operated because you're old, or you have lung diseases, or you have some other diseases. Then in 2002, the first aortic valve implantation was done in a live case in Paris by Dr. Alain Crevrier. This was done without surgery from the root of the groin, and it was successful. This revolutionized the treatment of aortic valve disease in our country and all over the world. So if any one of us or any one of you has problems probably related to the heart, which can be chest pain, breathlessness, or it can be you feel giddy, or you feel that you're going to black out, the first thing one must do is get to the closest hospital immediately. Once you are stabilized, and of course if you're close to PD Hinduja Khar, contact us, we are available 24/7. But once you're stabilized in this hospital, and if you have a preliminary diagnosis, feel free to contact us anytime, and we are able to help you for your all structural heart related concerns at any given time.